Okay, so this is our CIVT acupuncture course, Observation Assessment. My name is Lisa Krill, and this is Autumn, and we are going to walk through the traditional Chinese medicine physical exam. The physical exam has 4 pillars. They are listening, smelling, looking, and palpating. So we'll start by walking through listening. During a traditional Chinese medicine exam, we are listening for 4 main things. We are listening to the owner take a history. We are listening to any noises that might be volunteered by the patient. Those can be coughs, they might be groans. We are listening to the chest, the lungs in particular, be they dry or moist, as well as the heart, and we're listening to the voice of the patient. So, for example, a cough might be dry, it might be wet, or a patient may have a dry cough but swallow after, which indicates damp. All mean different things. A cough isn't necessarily just a cough. Another example would be the strength of the voice. Autumn, though she's being quiet right now, has a very strong bark. So that is good, that is robust. It does not necessarily indicate a deficiency. Whereas a friend's dog, who I have assessed, has a really weak bark, even when wanting to express themselves at full volume. So that usually suggests a deficiency. And in that dog in particular, I feel like it may suggest a qi deficiency. Now, smelling is something that we also do in Western medicine. If you think about how we describe ear infections as, oh, yeasty, you can smell him right when he walks in. It's the same in Chinese medicine. So areas that we might find smells would be the ears, the breath, or gassiness. Skin as well in some skin cases. Now, the owners might also volunteer if the urine or stool has an unusual smell, and that would be an important part of the previous history. For Autumn, she does not have any particular odors to her ears, but previously, before I diagnosed her skin allergies and got her on a special allergy diet, she did often have relatively odorous ears with a mild discharge, and that would be indicative of damp. Now, the next part of the physical exam is palpation. I think this part is extremely important. We are palpating along, for 4 key things, we're palpating along the meridians. We're looking particularly at the back shu points as well as the ventral alarm points. We're doing a full myofascial palpation, which involves palpating each muscle group distinctly in the forelimbs and at the back, just in an inquisitive way, looking for any changes. We might find here trigger points or shi points, which are sensitive points off a channel. The other thing we often do would be feel the temperature of the ears and the paws. Autumn is universally hot whenever you feel her. And we also palpate the pulse. So to give a bit of an example, we'll see if Autumn will comply here. When we're feeling along, looking for any changes, just a general scan to start is helpful, looking for big areas of heat. Now, Autumn has elbow dysplasia, and her area right along her elbow and her bicep is very, very hot. So that's an area I'm going to come back and scan in more detail later, particularly with the myofascial exam. Now, feeling along Autumn's back, there's a little bit of heat that I get just caudal to the TL junction here. And so usually when I feel something like that, I start to gently work along, palpating just really gently the back shu points, starting at bladder 11. I'm just looking for reaction, sensitivity, changes in the texture of the epaxial muscle. So Autumn pretty consistently reacts around the level of L2, uh, which is the back shoe point for the kidney. Now, no, I'm sorry. I'm sorry. She also has very consistent, and I'm out of treats, so I won't do it now, but she is very reactive as well as gallbladder 27, which I believe might be another compensatory point for her hip pain. But those sort of make sense with Autumn's overall diagnosis. Autumn has congenital dwarfism, so she has bone abnormalities, which can be related to a kidney yin deficiency. Now, there are a few things that we are going to look at in the patient, and the same as in a Western exam, that starts right away as the patient enters, and we just slowly pick up those little details. But then we look quite specifically. So the gait of the patient, are they lame, ataxic, weak? The behavior of the patient, are they exuberant and bright and friendly? Are they fearful and shy? Do they have any skin lesions or abnormalities that are visible? And the tongue exam, which we'll discuss in more detail later. Now, in terms of behavior, Autumn is very much a fire dog, though she is not giving us signs of that right now. She's just had breakfast and is relaxed and happy. But she's very exuberant. She is a fire dog, which I believe can help or sort of worsen some of her imbalances. Whereas I have a friend who has a really relaxed Labrador type dog who is always getting GI issues. So that dog is an earth dog who might be prone to changes and issues with the spleen. So sometimes those little details with behavior can help us out regardless. Now, moving on to the next factor we assess, the pulse. The pulse is typically in small animals assessed from the femoral area. Autumn's pulse I would describe right now as superficial, toned, and of normal rate to maybe a little bit more rapid. Yeah, that's okay. Good girl. So we are assessing in these situations rate. Rate might indicate hot or cold. The position of the pulse, so be it superficial, that would be an exterior factor, or deep, which might tell us about more interior issues. The tone, being the most important element, is how sort of punchy it is against our fingers, how easy it is to feel and a lack of flaccidity, as well as the diameter of the vessel, be it very, very thin or a very plump vessel. We may also feel changes in rhythm as well. That's another factor. Now, two key pulses in Chinese medicine would be the choppy pulse and the slippery pulse. A choppy pulse is a pulse that feels inconsistent against the fingers. It feels rough and it changes in amplitude. So that is a pulse that we might see in a blood deficient patient. Now, a slippery pulse, so that pulse is very, very smooth, very consistent in its reach. So instead of a choppy pulse, maybe not hitting your finger with the same amplitude every time, this feels very consistent and smooth. It's been described as pearls on a string against the fingers. Now, Autumn, if I had to say, might have tendencies towards a slippery pulse, though I'm still learning pulse diagnosis. That is something that we can see with patients who have some damp. Okay, good girl. Now, another factor we look at is the tongue. We do try to look at the tongue in a natural way as opposed to opening the animal's mouth. You might see the tongue as soon as you walk in and just take note, or a dot jot, or sometimes they'll respond to treats. So Autumn's tongue is pink to red. It is a very vibrant tongue. It's typically quite dry. It's not wet and it's not flaccid. So we look at tongues for color, moisture, size, and flaccidity or tone. Red tongue, like we have in Autumn, usually suggests heat, whereas lavender tongue, which I've been surprised to see more often than I I thought I would, can suggest stasis and one of the factors. So for example, blood stasis. Okay, so overall, those are the components of the physical exam and assessment. And I will respond to questions as they come up about this video. Thank you very much.